He died.
New at 6, more than half of the new cases of HIV happened in just 48 counties in the country. This week, those infections are the focus of a team of medical leaders in Atlanta.
Channel 2 anchor Wendy Corona joins us now in the studio. And Wendy, despite new infection rates being down nationwide, Atlanta still has a high number of cases.
That's the case, and the push right now to identify, educate, and treat. The national conference in town now is held by the Centers for Disease Control and Prevention. This year's theme is getting to know new HIV infections. And the people we spoke with today say it is very possible.
We have all the tools to stop HIV.
It's the goal of all who are gathered this week in downtown Atlanta at the CDC's National Conference on HIV Prevention. Giffen Dottridge is the CEO and co-founder of UrSure. His team created a new tool to get us closer to no new HIV infections.
In the guidelines, adherence support is important.
This is an adherence urine test, which looks and works much like a pregnancy test. One line means good levels of PrEP in the body.
Pre-exposure prophylaxis, also known as PrEP, holds a key for reducing the transmission of HIV for those that are HIV negative.
But if that second line shows up, that suggests that they're below the adherence threshold.
While it checks PrEP levels in a patient's system, PrEP only works if taken on a daily basis.
If you aren't measuring actual adherence, the only way you know if the patient's not taking the drug is if they become HIV positive.
UrSure's test in collaboration with Healthvana's software puts the power of knowing in its patient's hands.
Within like 2 days of your visit, you may have that real-time result on your phone and you know what to do next.
So the goal is to educate people, get them into care, and then also help them to maintain that treatment. And sometimes that means more follow-up communication or even counseling. UrSure is now in 7 clinics in the U.S., looking to expand to help more people understand how important adherence to treatment is in the preventing of the spread of HIV.
We have to remember it's still out there.
It is.
We don't always hear about it, but it still exists.
And we want it eradicated in 10 years' time. They say it's very possible to do.
All right, Wendy, thank you.
In 2016, a Channel 2 Action News investigation looked into the growing HIV and AIDS problem in Atlanta.